Hello, I'm John Holmes, CEO and co-founder of Microneedle Diagnostics, developer and manufacturer of the VivoSight OCT skin imaging system. In this talk, I'm going to explain how you can use OCT to image and monitor the response of skin after microneedle array patch removal. So first we can look at the holes or pores left by the microneedle array post removal. So this image, which is produced by the VivoSight, shows the surface topography of the skin, and you can see the individual pores left by the microneedles. And then when we repeated the scan 21 hours later, they're still there, but they're a lot. They've really subsided in depth. And we can look at the images, of course. We can look at subsurface. So immediately after removal, you can see that the pores, the microneedles have left holes in the skin. We can measure the depth of those. And we look at that from the top view and the side view. 21 hours after the MAP has been removed, those pores have disappeared virtually. There's just tiny little indentations left. But we can still see areas of fluid, pools of fluid in the dermis below where the microneedles were originally penetrated. And this image here is a 3D rendering of the image stack 21 hours after the patch is removed. You can see these dark patches are areas of fluid within the dermis, and in a moment it'll actually show you how we can also see that from a top-down perspective. So you can see that the top surface, there we go, and there are those areas of fluid deep in the dermis. There we go. But then on the surface, just a little dimples. So VivoSight OCT also has a capability to image blood vessels. This is an actual screenshot of the machine display after capturing an image of some tissue which has had some patch removed, and there is some erythema. Now we get we can see all the vessels, the map of the vessels, and importantly we can also get measurements of the depth of the active plexus, in this case 241 microns, just under a quarter millimeter down. The diameter of the vessels, the most common diameter is 57 microns, and the density 40%. So there's quite a lot of tissue is comprised of active vessels at this depth, and these data comes up straight away. So we can actually do this at several time points. In this particular example, we've got some skin that has been scanned prior to insertion of the MAP, and you can just see some vessels, and the measurements by OCT showed that the plexus was at 430 microns deep, vessel diameter was 36 microns, and the density was quite low at 9%, and that's typical of healthy normal skin on the limbs where this was performed. But then a microneedle array patch was applied for an hour and then removed, and then the result was then scanned, and you can see there's an immediate erythema response, and we got these measurements which I've already explained. So this showed that this erythema, this removal of patch, microneedle array patch, resulted in an activation of a lot of shallow vessels and resulted in the vessels dilating at a much higher density. And of course you can see that in the pink of the skin, but we can quantify these numbers very, very precisely. And we can also see that. We can actually create a sort of little video that shows the response. So this is immediately after application, 0 minutes, so a lot of vessels activated, and then within about 10 or 15 minutes it's died away, and a lot of the vessels are deactivated, the vessels are shrunk. So this is a very powerful way to measure the tissue response post-removal. This may all affect, of course, the delivery of the drug, so very, very important. And here are some charts. So we did repeated scans over a 60-minute period, and you can see that from a peak of 30 to 40% immediately after patch removal, it took about 20-25 minutes to return to a stable 10%. Likewise, the vessel diameter started off at 75 microns in this case, and then subsided to a more normal level in the mid-40s after about 25 minutes. And likewise, the depth. So these shallow vessels that were activated, deactivated over that period of time. So this series of charts has given us an insight into the inflammatory response post-removal of the patch. We also have, with the VivoSight, an additional software tool which we call VivoTools, and this analysis software can be used to analyze previously captured data and extract numerous further parameters. So, for example, the surface roughness of the skin to a very high precision, RA and RZ. We can extract a chart of the vascular density versus depth. So in this particular case, we see a difference of the two of this response between 19th of February control and 14th of May in a treatment regime. We can it also extracts numerous other parameters such as the epidermal thickness, the variation of that thickness, and the contrast of the epidermis, all of which are parameters that might be affected, along with the surface reflectivity ratio and attenuation coefficient. Now, if you're using an MAP to repeatedly deliver a drug, for example, if the patient is expected to apply the MAP on a daily or weekly basis, it's likely that the skin will respond over time and you'll get thickening of the epidermis. You might get changes in the collagen content, all of which could be monitored and picked up with this powerful processing software and OCT. So a very, very useful way to actually monitor the response of the skin post MAP removal. So in summary, VivoSight OCT gives you a very powerful tool for measuring, for visualizing and monitoring MAPs ex vivo, in vivo and post removal. It can be used to measure the penetration depth, the swelling and dissolution behavior, the inflammatory response of the skin, and details like the vascular plexus depth, the vessels, skin recovery. And this is all very, very useful information to enable you to optimize MAP design for your application for the very best results for your clinical studies. And thank you for listening.